Welcome to Share the Health, a new podcast from the Ross County Health District, where we discuss health issues that affect our community. I'm your host, Sarah Smith. Today I'm joined by Ross County Health District Public Health Nursing Director, Morgan Kelley. Welcome, Morgan.
Happy to be here.
Well, thanks for taking the time to chat today. So, what drew you to pursue a career in nursing?
Well, I decided nursing. I was torn between being a nurse and being a teacher. Teaching has a lot of, obviously education. I'm kind of drawn to the higher level education. We get to do that a lot in nursing. So combining both of those roles, it just seemed like kind of a no-brainer.
Yeah, you have so many different opportunities to educate not only the public, but I know you guys also do a lot of partnerships with Ohio University Chillicothe and their nursing students as well.
We do. They have a very strong program. We partner. We have a good collaboration with them. They will help us with some of these flu clinics that we're about to go into here. And I think, as we continue, the future is bright in the nursing world.
Wonderful. All right. So being in October now, does that mean that flu season's in full swing?
Flu season is typically from October to May. Here in Ross County in 2024, 2025, we peaked in February. We had 110 cases total. March, we had a total of 47 cases. Those are only hospitalized flu cases. So we do have, more flu, but those are people that don't have chronic conditions or don't end up hospitalized. So those aren't reported to us as a county.
Yeah, and when we talk about the flu season duration, just myself, I always think Thanksgiving time, Christmas time. I think a lot of times you think once you get into spring, I'm clear now, but that's not necessarily the case from what it sounds like.
It is not the case. Unfortunately, this virus just hangs on to about everything it can. It's really important to, disinfect handles. We all we lock ourselves in rooms, right? Think about when kids go back to school. We're outside playing and they're not sick at all in the summer. They get back to school. We're putting them all in a room together. They're all touching the same stuff. It's the same thing when we go to the grocery store or, we do anything. We do all of that shopping in Thanksgiving, Christmas time, and then we just end up spreading it, and the numbers seem to tick up right after that holiday season.
Yeah, the gift that keeps on giving.
That's the truth.
The one that we don't want. Yeah. As far as the flu vaccine, who is eligible for the flu vaccine?
So the CDC says that everyone 6 months and up is eligible for the flu vaccine. Our eligibility is very similar to that. We do carry 3 different types of vaccine, so we can cover just about anyone. We do have Flu Zone, which is for 65 and up, which is frequently considered as the high dose. And then we have the flu vaccine. That's kind of just for everyone else, the traditional flu vaccine that you and I would probably get every other flu season.
So depending on age and prior conditions, that has a bearing on which flu vaccine you're given.
Kind of. There's some opportunity there. Some of the flu vaccines do have egg in it. Some of them do have a preservative that some people can't have. We do a screening process when you come in to make sure that we're giving you the one that's going to be best for you and give you the most appropriate coverage so that we can try to keep everybody healthy.
I know you'd mentioned that the flu season hangs on even into March. So does when you get your flu vaccine administered play a role in your susceptibility to getting sick?
It does. It takes about 2 weeks for you to build immunity to the flu vaccine. So that's why we encourage that October time period. The holidays come quickly thereafter. We talk about Thanksgiving and Christmas and everybody, being in close quarters. We start our Christmas shopping. We're out. We're way more active in the community. So it's definitely important to make sure that you at least have a 2-week buffer from getting that. If not, please don't not get it. We still want you to get the flu vaccine. We just, try to give that 2-week buffer for best case results. We want you protected through the whole season. So early October is late September, early October is what we encourage, but we're going to continue to administer the vaccine as long as folks will take it. because getting it, period, is kind of the goal. We want to avoid, those inpatient hospitalizations as much as we can.
So it sounds like it's better to wait until at least maybe September so your vaccine will last through that beginning of spring, from what it sounds like.
Yep, you got it.
Okay. So what are some of the more vulnerable populations to flu?
So 65 and up is going to be the big one right off the bat. You think about it, as we age, we do start to fall apart a little bit. Obesity just by itself is a high risk factor. But you talk about smoking, you talk about anything, we eat terribly. Any of those are contributing risk factors. High blood pressure, high cholesterol, any of those can be contributing factors with our age. It kind of takes our body a little longer to fight off some of these infections. And what we want to do is, protect ourselves before it gets us.
That makes a lot of sense. What are some practical tips for staying well during flu season?
So obviously vaccination, I will forever be an advocate. Vaccination is best protection, but obviously, distance, staying home when you're sick, not exposing other people. There's testing for the flu. So, if you're not sure, seeing a provider that can kind of navigate that with you. Unfortunately, COVID is a thing, flu is a thing, RSV is a thing. Also we have the common cold. So,
all the things.
Yeah, you can be tested for any respiratory infection anymore. So it's good to be able to kind of navigate that with your primary care provider. So if you do need treatment, you can get treatment. But also, to avoid giving those vulnerable populations, I'm a healthy 40-year-old woman. I'll be okay, but that doesn't say, I may have a kiddo at home, or I may have, my parents who, are well over 65. I want to protect them. That's what I worry about. As my other loved ones at home, our school kids, they're pretty vulnerable. They touch everything. They're into everything. They're in each other's faces. Our long-term care facilities, unfortunately, they still have to go out and go to the doctor's appointments. Well, if I'm sick and I'm going for one reason, they're likely going to be in the same waiting room, but they're healthy. And, just doing our best to protect everyone.
Mm-hmm. Yeah, I think that's really good that you're highlighting that it's not just about you, that there are steps that you can take to also help take care of the people around you who can't fight off those sicknesses as easily as you can.
And sometimes it's as simple as, I sneezed, let me go wash my hands, or I coughed in my hands, let me go wash them and ask for a mask, or, not only to protect yourself, because maybe it just is a cold, but the guy sitting across from you, it may be a little more severe than that, and it may be something that you can get. So just taking care of, not only yourself, but everybody else around you.
Mm-hmm. I think those are excellent points. So you mentioned a little bit how to reduce the spread if you are sick. You mentioned physical distance, staying home. As far as returning to normal activities, are there any guidelines for that?
So it kind of depends on what you're actually diagnosed with. We don't want you, if you have a fever, to be going anywhere. That's kind of the primary thing. But the traditional, gold standard is fever-free for 24 hours. But we still want you to take the precautions in the meantime, right? You think about before COVID times, we never wore masks. We didn't even think about it. We just, kind of snotted all over the place and coughed. And, we just told everybody, cough into your elbow. That was the gold standard then. Things have changed a little bit just because, respiratory illnesses, they tend to mutate. We talk about, well, how good is the flu vaccine? It may work this year, it may not. Those are all very valid points. And I will not, that's a bigger discussion than I think what we have time for today, but it's one of those things too that we keep on the forefront because we do want to promote still healthy habits, good activity matters, being healthy, being able to, get out and do things. We want to continue to do that, but in order to do that, we have to, make good decisions, wash our hands, disinfect, take care of each other.
Yeah. So as far as activity, so having the flu versus like the common cold. So for example, say if you have the common cold, should you still be exercising at that point? Or like when, is there a kind of a rule of thumb of like when you need to just rest versus kind of push through? Or does it really just kind of depend on how you feel?
It's super personal. Obviously, when your body's battling anything, rest is best. We want you to, get on the mend, but unfortunately, it's not easy anymore to be able to discern, is this, just a common cold or is this the flu? So, avoiding, those crowded places if you go to a gym or, we always like to say like activity is tolerated just so that we know, I don't want you to push yourself to a point, but I also don't want you to, lay there and develop a pneumonia either. I want you to, seek out medical treatment. We do have some places in town that will help you for free. If you don't have the funds, we don't want you to wait until the last minute, end up in the ER or, we're huge advocates. You can call over to the public health division anytime. We'll try to give you some guidance and help you. We have nurses here Monday through Friday, 8 to 4:30. So even if you need somebody to just take a listen to you, we can do that too.
Yeah, we've got great nurses here, more than willing to help out. So as far as treatment, if you have the flu, what are some of the treatments that are available?
So the only treatment is antivirals. If with the flu is still a virus, right? So you won't get a traditional antibiotic like the amoxicillin or, Bactrim, and none of that's going to help you if you have the flu. They'll try to give you an antiviral. There are some timelines with antivirals. So typically it's like within 2 days of getting sick. So getting that treatment pretty quickly. The antiviral is not going to cure you by any means, but what it's going to do is shorten the duration of the illness and it's going to lessen your symptoms. So we encourage that still has to be provided by a prescriber and we don't have one of those here. So we still do encourage you to, seek out your primary care provider or, go to urgent care so that they can help you kind of navigate that. There are some restrictions with that, but it is still something, it is an option.
Because you mentioned you need to get that within the first couple of days of symptoms. So it seems like what happens a lot of the time, like start getting sick, you think, oh, maybe it'll blow over. And then week goes by, 2 weeks. And at that point, if it's a virus, it sounds like you just kind of have to ride it out, basically.
If it's viral, sometimes some viruses, can turn into bacterial infections, which an antibiotic wouldn't be appropriate for. So that's why we always encourage, to get that treatment sooner rather than later. Obviously, I don't want you, on day one, if you're only got a little bit of a sniffle, we don't want you running to the urgent care and, doing that. But, we also want you to take care of yourself and, protect others.
Those early symptoms, so if you've got like a fever or a sore throat, things like that, those would be the types of symptoms you definitely want to go be seen.
100%. Yep. Those are things that, we want to make sure that, you're brewing something if you have a fever. It's up to the higher paid professionals to decide what that is, whether that be a mid-level provider or a doctor, but seeing someone, who can prescribe medication, someone who can kind of navigate that with you, do some testing even to see, are we talking about a bacteria? You have a fever and you have a sore throat. Well, do you have strep? Those are all very valid concerns and questions. We don't want you laying at home with strep either. So seeking treatment's important too.
And we mentioned COVID a little bit. So at our nursing clinic, we can actually do COVID testing now, can't we?
We can. We do have, it's free. It's free of cost. All you have to do is come into the clinic. That is a service that we offer Monday through Friday. It takes about 15 to 20 minutes to do the test, but it is PCR testing. So it's a higher level. Those are the ones during COVID that they would say, we have to send that out and we'll get back to you. But we have a machine here that does it, in real time. It's a little more sensitive than like the point of care testing that you would have at home.
So you talked a little bit about flu vaccine efficacy. So do we know how effective the flu vaccine was last year?
So last year was about 56% per the CDC. That's still very preliminary, but that seems to be kind of the trend that I've noticed. They do track it every year. They do try to make it obviously effective as they can, but 56% is pretty good. That means they were able to match the strand that actually came out pretty well. There's some science, like they do some testing to see what they think is going to be the new strand, and then they develop the vaccine based on that.
So it's a little bit of a guessing game when they're doing the vaccines for what's going to be the worst strain that particular year.
Yeah.
It's almost like the flu lottery, kind of like what's going to be the big winner this year.
And they have had some years on the CDC website. It's all kind of like broken down, but they have had some years where the efficacy hasn't been that great. But I think it kind of just depends, and nobody knows until the flu year's over. So that's kind of the hard thing, is it is a gamble. But, if you're in one of those vulnerable populations, it's super important to, cover yourself and protect yourself even. So we are still, obviously big advocates for that.
Better safe than sorry.
Agreed.
Yeah. We're in the middle of our flu vaccine clinics now in October, going in through November. So it looks like we're going to be going all over the county with that mobile unit, right?
We are. Looking forward to being out in the townships and being able to just provide, whether you fall into either of those groups, the VFC group, the 317, the private, we're going to take all of those different types of vaccines with us so that we can cover you appropriately. And sometimes it's nice to have somebody come to you.
Mm-hmm. We'll come to your community so you don't have to come to us all the time. Yeah. But you guys are also doing some extended clinic hours too as well, right?
We are. We have one more scheduled for the year, November 5th. So we will be here till 8 o'clock that evening. It's walk-in. We prefer that you have an appointment just so that you don't have to wait. But we also won't discourage you or turn you away if you just walk in.
Great, especially for folks who maybe can't make it here during our regular business hours, or if you've got kiddos that maybe have a lot of activities, can't make it during, our normal hours until 4:30. So we'll be here till 8 those days. And then we also have the COVID vaccine available, right?
Only to certain populations. Currently, we have Moderna and Pfizer, the 2025-2026 versions, and we are administering those to 65 and up at this time. That may change when further guidance becomes available, but as of right now, that's what we're running with, is the 65 and up, that very vulnerable population to COVID.
October is also Breast Cancer Awareness Month, and we have public health nurse Denise Ruby here to share with us a little bit about her own personal journey with breast cancer. So welcome, Denise.
Thanks for having me. Nice to see you.
Wonderful to have you here. So what are some things that you'd like to share about your own story?
Well, I would say I am somewhat typical as far as breast cancer goes. I looked up some statistics. And I want to say it was the average or the mean age of a woman getting diagnosed is age 60. And that's what I was. But I've been getting mammograms every year, probably since I was 40. It's just one of those things you do, especially being a public health nurse and just a nurse. I understand that, you get your screenings. Every year it had been fine. They told me I had dense breast, which is a common thing. A lot of women might have heard them say, and sometimes that can be a little more challenging, especially for breast self-exam. But in my case, it really didn't matter. Last year's mammogram was fine. This year's mammogram, not so much. They saw lots of little microcalcifications, which looked suspicious because they were in a certain kind of pattern. And so they called me in. The guy was very, pretty straightforward with me, saying, well, yeah, this could be something. But didn't alarm me a whole lot. And it turned out I did have ductal carcinoma in situ. So it was cancer. But because I had my screening mammogram, it was something they said they were so tiny you would have never felt them on your own by doing a breast exam anyway. Although those are important and some cancers are found that way. But this particular type of early cancer, this is exactly what the screening is meant to do, is to find that out as soon as possible, and then go from there. And I would say every woman's journey is different, and everybody's circumstances can be just a little bit different, and it can really be overwhelming. I think as a nurse, and as a nurse who has had additional training and a couple of research classes, I kind of could look at things and actually literally do a little of my own research. And I understood the jargon somewhat and knew the questions to ask, so I wasn't that intimidated. But it boils down to I ended up needing a mastectomy on one side because there was just too much tissue to do a lumpectomy, and I decided to go ahead and have the other breast removed because I didn't want to have to worry about, even though they said statistically probably would not happen, I didn't want to worry about it. And if I was going to do reconstruction, which I am, I wanted sisters and not distant cousins, so to speak. And fortunately, insurance is good about covering that now and some of the things, the treatment for cancer. I look back to all the women in the last 20, 30, 40 years that dealt with breast cancer and, appreciate those who participated in research and kind of came before because things are a lot different now, and it's very treatable no matter what stage. But the earlier you can catch it, the less treatment that's required. So for me, I had a bilateral mastectomy with tissue expanders, which means basically kind of stretching the skin so that I could get implants. That's going to happen next year. And then from there, also, they do 3D nipple tattooing, something that, again, can be important for people if you want, to feel and look like your normal self, at home.
Something that really stuck out in what you were saying before was about how even doing the self-exams, what you had personally, you wouldn't have been able to detect it. So that's why you said it's that much more important to still do the screenings.
Correct. Yeah, they described it as probably like a large grain of coarse salt. So they were pretty tiny. So that's why, again, if you're in that category that's been told you need to get those annual screenings, then yeah, you want to do breast self-exam regularly, but you also want to do the imaging that's required. And then for younger women, what's kind of alarming is that we are seeing more cancer in younger women before the age of when we typically start doing mammograms. Even more important that they do monthly self-breast exams after their period's over, after, if there's any swelling or tenderness with their monthly cycle. But it's a good thing to know your body and to know if something has changed and to get that checked out. Because, again, the sooner that a problem's identified, and, I know human nature, a lot of us, it's like, no, there might be a problem. I'm just going to ignore it. It's like, if it's a problem, it's not going away. And, it's just a horrible shame if folks don't get evaluated out of fear because, it is a scary thing. But there are people, again, there are nurse navigators. There's other experts, folks you can reach out to. Heck, you can even call the health department here and ask for me if you like. And again, every case is different, but sometimes, again, folks need a little bit of reassurance and some pointing to some good resources. So
as far as what age do you need to start doing mammograms?
Typically, I think the age is still around 40. So, yeah, annual mammogram at 40. Depending upon, again, if you have a family history, make sure if you've not talked to your primary care provider about that, if there's a really strong family history, do you need to get genetic testing? Because there are a couple of genes that have been implicated, or we see that there's much higher risk of cancer. I think it's called the HER1 and HER2 genes. There's actually quite a few other genetic markers that they can test for, and they did for me when I was up at the James. All that came back negative, but it's important. That's a part of a whole clinical picture. What's your stage? What's the grade of the cells? What's your genetic status as far as if you have any of those types of genes? That all makes a difference as to how they think they're going to do the treatment too. Okay.
How do they conduct the genetic testing? Is it a blood test?
Yep, just a blood draw. Pretty easy. Yep.
So as far as the self-exams, like women even in their 20s and teens, should they be doing those?
Yeah, I would say as soon as you start getting periods, really you start to just need to start kind of getting in touch with what's going on there. And yeah, it's pretty straightforward. I was not always the greatest about doing it because I did have what I call lumpy, bumpy tissue, which again, that's kind of that, well, sometimes they call it fibrocystic, but really it's just, they call it now, it's dense breast tissue. And that's where also, again, someone with particularly dense breast tissue, it may be that you can advocate for yourself and maybe you need to get ultrasounds or something additional. So if you're worried about something like that, you could talk to your primary care provider or aims to see if there's other options for you. Yeah.
So as far as prevention, you said the best things to do are the self-exams monthly, getting your screenings if you're the right age.
Right.
Are there any other preventive things?
Just the same thing that we recommend for being healthy in general, which is, trying to eat a somewhat balanced diet, everything in moderation. Physical activity, super important. Again, that helps us kind of, maintain a reasonable weight. Again, we have different body sizes and whatnot, but being, fairly fit as you can be, moving as much as you can. So, and avoiding excess alcohol, not smoking. There's no tricks to it. And I'd also like to say you can do everything right and still get cancer. I think subconsciously even though we know and we understand people don't do anything, there's a stigma about it or about having a cancer or an issue. We have bodies. Sooner or later, they're going to break down. Sooner or later, all of us are going to die. I don't care how well we take care of ourselves. But cancer is just something that happens. It can happen to people who abuse their bodies, and then it can happen to somebody that does literally everything right. Everything's a conscious decision about how they treat, how they eat, how they move. So it's just a matter, we have to be vigilant no matter who we are. We got a body, something could happen.
Yeah, cancer doesn't discriminate.
Right, exactly. And really the mental health aspect of it can be just as big a deal for some people as others. Everybody reacts differently, but we also need to think about that when we're thinking about like cancer treatment as well, and understanding that that's why being around other people maybe who have dealt with a similar diagnosis or talking to them, even if their journey's not exactly the same, they may have had a lot of similar emotions, and that can be helpful.
Mm-hmm. So. I've got some friends who go, they're cancer survivors themselves, and they go back to the hospital maybe once a month, and they visit with patients who are currently undergoing treatments. They say that's really helpful, not only for them, but also for someone to see, like, I've been where you are,
right.
I understand, just offering that support.
Exactly, yeah, because, it can get rough depending upon what your treatment is. And like I said, I feel really fortunate in that mine was caught early and I didn't have to deal with some of that. But and then, of course, having a really supportive spouse helps as well, and family and friends. But there are people, even for folks that feel like they don't have a lot of family support, there's support out there if you reach out and if you ask wherever you're getting seen or evaluated. And it's always okay to ask for a second opinion or get a second opinion. And for those women who maybe are like, well, I don't even have health insurance, I can't get screenings, there is the Breast and Cervical Cancer Project that can cover the cost of those screenings, and then I believe also would help cover the cost of treatment if that was needed. So no real excuse, really. And like I said, if I had just ignored this and not gotten my screenings, I'd have been probably fine for several years. Most of the time, ductal carcinoma in situ can be slow growing, but mine actually was kind of a higher grade, so maybe not. I don't know. But like I said, if you can nip something in the bud, that's the best thing to do.
Well, thank you so much for sharing about your own journey with breast cancer, Denise. It's very courageous of you to share, what you've been experiencing with everyone listening. And are there any other takeaways that you'd like to just leave with anyone listening? Yeah,
I would just say you never know what tomorrow holds. And so you're only going to be you're the youngest today that you're ever going to be, right? And really, you do have to try to, be grateful for what you have today, because at any point in time, whether it be an accident or a diagnosis, of yourself or someone else, life can change in an instant. So really being grateful for what you do have and what you can do. and trying to find the positive as much as possible, because I really think if you decide, hey, this really stinks, but I'm going to get through it and I'm going to find resources. So I just made up my mind that, hey, this is just something I got to deal with. And to be honest, after, it wasn't that hard. My mood was actually better when I was kind of more in the middle of things. And now that I'm just kind of waiting to get my implants early next year, I'm kind of in a little bit of a funk, but that may be also because it's fall and I'm thinking about winter coming. I don't know. So that's the thing. Your emotions can be all over the map, or whatever you're responding as, that's normal, because that's you. So don't deny what feelings you're having. Reach out for help if you need to. Like I said, if you're not sure where to reach out to, give us a call and we can help you figure that out too. Mm-hmm. Okay?
Just take it one day at a time.
That's right. And be grateful every day for something. Usually there's at least 2 or 3 things every day we can be grateful for. So,
I love that.
Yeah.
Well, thank you so much, Denise. Thanks so much to Public Health Nursing Director Morgan Kelley and Public Health Nurse Denise Ruby for joining us today. Visit our website at rosscountyhealth.org for more information about our upcoming flu shot clinics, programs, and services. Until next time, take care and share the health.